Hello everyone, today I'm going to present the sciatica fracture case, show you the scans of the injury, and give you guys time to guess which sciatica fracture the patient sustained prior to revealing the answer. So in this case, the patient has a lateral tibial plateau fracture of their left leg, which you can see here in the scan. One of the first things that really pops out to you is the fact that the space between the distal femur and the proximal tibia has widened significantly, and that is happening because there is a depression of this lateral tibial plateau here. The second thing you really notice is the fact that there's this fracture happening of the lateral tibial plateau, which you can see even better from this transverse view over here, how it goes pretty far into the tibia. And you can really see both decently well on this sagittal view of the person's femur and tibia, where you can see the fact that there's depression of this tibia along with fracture lines going in. So I'm going to give you a second to think about which sciatica fracture type this is. Comment down below if you think you know the answer. So for those of you who said type 2, congrats, you're correct. So the reason you know this is type 2 is because there is this depression happening, which I showed you guys earlier, and there's a fracture line of the lateral tibial plateau. So because there's both of those factors, it's going to be type 2. If you had just seen a fracture with no depression, it would be type 1. And if you had just seen depression with no fracture, then it would be type 3. But because there's both, that makes it a type 2. Sciatica fracture type 2s are generally considered the most common type of sciatica fractures, and this makes sense if you remember the fact that lateral tibial plateau fractures in general make up about 3/4 of sciatica fracture cases, and that is because this lateral tibial plateau is less dense and weaker than the medial tibial plateau. So you're going to see more fractures there than you would on the medial tibial plateau, most likely. Another thing to check for in this type of injury is to double check that the patient doesn't have any other injuries along with this one, like a lateral meniscal tear. And that is a good thing to check for because those types of tears are associated with sciatica fracture type 2, so you want to catch it and be able to repair that along with the fracture. This fracture was actually repaired with open reduction and internal fixation, which you can see here, along with this lateral view where you can see the plates being put in. So thank you so much for watching. If you like this video, please check out my other sciatica videos as well. Thank you. Bye.